Mr. Speaker, I want to thank you for this opportunity, for giving me to have the first bite to the cherry on this report on the working visit of Kwale, Mombasa, and Taita Taveta. Mr. Speaker, I'm praying one day they will also be able to come to Nandi. And Mr. Speaker, I'm a great champion of doing our things at the grassroots level, because that is how Senate will have the impact. That is how Senate will have the impact. I agree, plenary is as important as what we do. But if our people, Kenyans, wherever they are, to receive value for what we do is to be on the ground, the boots on the ground, and I want to celebrate the Committee of Health, Mr. Speaker, MATIANG'I. They have a number of reports on devolution and intergovernmental committee. I want to thank committee through the Vice Chairperson, Senator Sheikh Omar, for the good job that they have done. This report, Madam Speaker, I'm very impressed. It is so thorough until they were able to tell us number of X-ray machines. They were able to tell us about the issues of oncology machines. They were able to tell us about dialysis machines and many other machines that are used, including imaging machines, and even both infrastructure, Mr. Speaker, because I'll just concentrate on observations and recommendations so that I can yield the floor for other colleagues, is that I'm impressed because they have captured funding, Madam Speaker, funding. They have gone to human resource issues. They have gone to infrastructure. They have gone even to technology in terms of use in dispensing. So anybody who reads these reports, Madam Speaker, will understand that the Health Committee went an extra mile. So, Madam Speaker, earlier today in the proceedings, formative stages, I did indicate that the success or failure of devolution will only be anchored on one thing: health. Because health is a cross-cutting issue, whether you come from Mandera, from Kisumu the way you do, or from Busia, from Kakamega, from Nairobi, where one of the delegates is here, and even from Mandera, where members, and even Wajir. Health is a very important issue, wherever you work in. Speaker, the most complaints I get, over 80% in Nandi County, concerns the issue around health. Lack of drugs, inaccessibility to facilities that are there, issues of infrastructure, and therefore the funding of health sector, Madam Speaker, is very critical. And therefore, you know, the Abuja Declaration demanded that at least 15% of budget should go to health sector. We are here to realize that both at national and county levels. Madam Speaker, even this factor is that is where we're having push and pull. One of the devolved functions that is having push and pull between national and county governments, Madam Speaker, is on the issue of health. Because under the Constitution, Madam Speaker, when you look at the fourth schedule, health is devolved. It behooves the national government, and that is why in the last session, when we moved to court to challenge the 22 laws that were not concurrent, Madam Speaker, one of the key issues in the amendment in one of the health laws then, when we wanted to challenge National Assembly before Justice Weldon Korir, the argument was simple that the work of health policy is exclusive domain of the national government. And therefore, we had push and pull, and that is why we moved to court, although the court agreed with us that there must be concurrent engagement between the bicameral. And I hope, Madam Speaker, going into the future, we'll be able to pass bicameral laws so that we can have a more neater engagement, because we don't want to see both houses as if they are competing over space. Madam Speaker, I want to celebrate because apart from health sector funding, health sector staffing in those regions, issue of, in terms of funding, issue of human resource and technology, they went further and even look about the issue of NHIF and social health insurance fund, the SHIF. And I'm happy, Madam Speaker, as of today, more than 25 million Kenyans have registered under SHA. And SHA is working with the 3 funds that we already have in place. I'm happy to report whenever I work in Nandi and across the country through our empowerment programs, Madam Speaker, and I'm happy you have been among most of our esteemed guests and support in many groups, especially in your county, Kisumu. You get people saying, Senator, SHA is working. I heard this bill. I agree there are some challenges, like paying for the whole year. I think we have agreed, and I'm happy the Minister of Public Service did indicate that they shall malipo pole pole, with the indulgence, Madam Speaker, of mixing the two languages. So I'm happy, but I think there are still liabilities of NHIF. I think the law is very clear that when a new entity comes in, they take over liabilities. So I want to appeal to the Ministry of Health, the SHA, to ensure they offset a lot of liabilities, because I see in most of these counties, like disbursement, like Coast General Hospital, EDA being owed 250 million, while Kwale County reported 96 million as liabilities in NHIF. I think the Minister of Health, CS Aden Duale, should seize this matter. And I want to thank the CS of Health, Aden Duale, because you remember, Madam Speaker, there was a normal matter where, in terms of Bachelor of Science in Nursing, in terms of placements, there were 348 interns that had been placed in our hospitals or our facilities without the proper procedure of the law. Madam Speaker, when you look at the public service, human resource policy guidelines on internship, and healthcare policy professionals, there is a certain way of engaging interns. And the revocation of 348, I think because they had not completed their studies, because completion and graduation and clearance from the over the body that regulate, like you and me, we are being cleared, or our regulatory report is Law Society of Kenya, for example. I know there is also KMPDC, Madam Speaker. I don't know, you know, Senator Kalwale is expert in gynecology, so I don't know whether they are gynecologist body that clears them. So in this 348, I want to CS Duale for doing a good job, Madam Speaker, but I want to appeal to the CS Duale, Madam Speaker, that as he goes ahead to remove the 348 that was irregularly, and remove, because I saw them coming to our gates yesterday, Madam Speaker, is to go further and punish those people who placed our children. Some of them were in Siolo, they were paying rent, they were paying internship money. Madam Speaker, we should make the process of doing an irregular thing in this country to be as painful and as rare as noble in hell, Madam Speaker, so that it can be a lesson to many others. And I'm happy, Madam Speaker, I think today you read a report on illegal organ transplant in the country. I saw the CS also commenting about it. I hope the chair and the members of health will seize that matter. Madam, and that is on the share issue, Madam Speaker. On the issue of budgeting, I want to appeal to counties, Madam. You know, I found it weird that, for example, Taita Taveta decided that in their supplementary budget of 2023-2024, they decided to remove money meant for health to come for development, from development to recurrent, as if health is not critical. Madam Speaker, the vulnerable in the society are normally the sick. The quality of any society, Madam Speaker, will be treated based on how they treat their vulnerable. So if you see a county removing 50 million in the annual budget of health for recurrent, Madam Speaker, means buying newspapers, buying flowers, traveling, perambulating, and calavanting around the place. Madam Speaker, is it more important in Taita Taveta to buy drugs or to travel for a retreat somewhere in Mombasa, or travel even to Dubai, Madam Speaker, unless it is budgeted? Number 4, Madam Speaker, on the observation is the Facilities Improvement Fund Act, which we enacted at the House. I think we have agreed that instead of them getting from county treasury or these approvals, they should spend at source, and I am happy but Mombasa County Assembly should move with speed and ensure that facility improvement fund is taken into focus. Madam Speaker, on human resource, I want to report that most of our, Madam Speaker, you know, you walk into, and I'm happy Cherargei'S Odinga Hospital has been, County Referral Hospital, has been gazetted as a state agency. And I want to thank His Excellency the President and Right Honorable Raila Odinga for ensuring that now at the Western Hemisphere, you know, people who live around Nairobi think that they are next to God, because they have Kenyatta National Hospital, they have Mbagathi, they have Mama Lucy. You, from Kisumu, you had to drive all the way to Moi Teaching and Referral, which was overwhelmed. People from Kakamega, Bungoma, even Uganda, but I'm happy we are now having Cherargei'S Odinga Referral Hospital now to assist us. The issue of, I remember Senator Kalwale, Madam Speaker, was following on Kakamega County Referral Hospital. I don't know how far did he reach, but I want to warn him If he wanted that Kakamega County Referral Hospital to be taken over by government, he should stop attacking government, because you cannot attack and defend at the same time, Madam Speaker, so that you can get Kakamega County Referral Hospital, so that I don't see, Madam Speaker, when you stand at Cheptulu, Chavakali, all the way, and this one of, you only see ambulance from Kakamega County government rushing to Moi Teaching and Referral Hospital. It looks like the poor healthy service provision by Governor Baraza in Kakamega. Because if you stand and count, you want to suicide sitting of ambulances, you only Kakamega County government, driving with the breakneck speed, all the way to Moi Teaching and Referral Hospital, Madam Speaker, which is very unfortunate, Madam Speaker. Madam Speaker.
Senator Methu, what is your point of order?
Can you even take water before requesting point of order?
Cherargei'S, you sit down and listen to
And Madam Speaker, I wonder what Senator Cherargei'S has with the water that he really wants me to take. We are very careful these days, but I would not have also wanted to disrupt him and disrupt his flow of thought.
Senator Methu, what
Yes.
is your point of order?
Yes, that is what I'm going to, Madam Speaker. I was just laying a background of why I'm standing. I respect Senator Cherargei'S. I'm rising pursuant to Standing Order 105, responsibility of a statement of fact. In the course of his contribution, Madam Speaker, I've had Senator Cherargei'S thank the President for gazettement of Jaramogi Oginga Odinga Hospital, but he was also quick to add that he's thanking the President and the Right Honorable Raila Odinga. I would want Senator Cherargei'S to tell us the role that Raila Odinga would have in the gazettement of a hospital in terms of...
What was out of order?
What is out of
You are
order?
raising on a point of
Yes,
order.
what is out
What
of
was
order?
out of order?
What is out of order, Madam Speaker, on responsibility of fact, it's not a fact that the Right Honorable Prime Minister Raila Odinga has any role in the gazettement of Jaramogi Oginga Odinga Hospital.
Senator Methu, I did not remember the word role being used in that statement.
What was used?
So,
He said
Senator
no, Madam
Methu,
Speaker, I mean, you
please
can't-
make your point of order properly,
Yes,
or with
I'm not withdrawing, Madam Speaker, because I'm saying that it is not a statement of fact, because what he has said, because we are interrogating what he has said, that he wants to thank the President and the Prime Minister Raila Odinga for the gazettement of Jaramogi Oginga Odinga Hospital. That was what he has said. And that is not a fact.
Senator Methu, I will treat your point of order as frivolous. Senator Cherargei'S, please proceed.
I'm sure you are conflicted, then I'm sure you can treat it as frivolous.
Wait a minute, Madam Speaker, point of order. Can you invoke Standing Order 101, 121?
Senator Cherargei'S, I have ruled. Please
Yes.
proceed with your...
And he should respect the chair.
I respect the chair, of course.
Of course, the human
Senator-
resource. I wanted, and you know, the health sector
Senator Cherargei'S, focus on what you were presenting.
I'm focusing. Even the health sector in Nyandarua, we must speak to it. I would have expected Senator May to tell us the poor health sector in Nyandarua, instead
Senator-
of raising frivolous
Senator,
point of
focus
orders.
on your presentation.
Okay, but I'm saying on the issue of workers, but I'm saying when you visit, and I exited the point that on the western part, that is why we need to thank. We are in broad-based government, and we are not ashamed, and we are not fearful to say we are in broad-based government, led by His Excellency President William Ruto and Dr. Raila Amolo Odinga. I know, Madam Speaker, in fact, he's not deep state. He should have been with Munyoro in the U.S. Madam Speaker, and therefore, like the issue of protective equipment, Madam Speaker, issues like providing health workers with salaries, Madam Speaker, I'm told the account is that they are not even giving risk allowances or extraneous allowances for the work that our health workers do. Madam Speaker, you are aware, and at least we have one doctor in the house, Dr. Kalwale, that most of the doctors and health work on call. Some of them are even called during odd hours when us, we are safe in our houses, Madam Speaker. So I want to believe that we must relook at the issue of health workers, Madam Speaker, and the County Public Service Board must be called to order, Madam Speaker. And I want to appeal to County Public Service Board, because I have studied public accounts. I don't know why the yellow light is there, and yet Metu took away my time. Madam Speaker, what I wanted to say, the Secular by Public Service Commission say when you reach 60, you must retire. Unless you are God sent. That's what the law says, Madam Speaker. I don't know, in our county public service, I've been in public accounts, Madam Speaker. We have been there with you on some of the occasions, even in committees. The retirement age is 60. I was shocked, for example, in Garissa, Madam Speaker, the chairperson of County Public Service Board is over 60 years, Madam Speaker, who is supposed to be appointed, Ahmed Abdirahman, over 60. So how do you expect the violation of the law? Like, for example, what is happening in Garissa, Madam Speaker. So we must ensure the County Public Service Board ensure salaries, extraneous allowances, and Madam Speaker, protection. When I went to Kapsabet County Referral Hospital, I met some doctors who even have to send the patient to go to Kapsabet Town to buy gloves, then come and be treated, including drugs. The place is dirty. Madam Speaker, that is why most of our medical doctors and practitioners are dying, because they don't have protective gear. They don't have protective equipment to protect themselves, Madam Speaker. Even as we talk about salaries, as we talk about allowances, we must provide them with a good working environment that is clean, that is hygienic, that is safe for our health practitioners, Madam Speaker. I saw my friend Kebore and Chairman Peterson Washira, among others, even Dafchi Atela. They should push beyond salaries. They should ensure there is proper working environment, Madam Speaker. So when I visited Kapsabet County Referral Hospital, I visited a number of facilities in Nandi, Maraba. I was ashamed. You see bed sheets lying around, very dirty. And these are contaminated, and you expect a doctor to treat you. There is no light. I was ashamed because I've seen in Mombasa County Referral Hospital, in the report, and I'm happy the committee you did expose this, that they are leaking roofs. Leaking roofs in the highest cost general hospital has a leaking roofs. Leaking, like the one we used to have in JKI. Madam Speaker, just to fix, to go up and just put an iron sheet with a nail. Do we need a scientist to do that? Do we need a professional, Madam Speaker? Because I can see like fixing curtains that we buy here in Italy. Coast General Hospital does not have curtains. They need Senate to direct them to fix curtains, Madam Speaker. There is also leaking roofs and hallways, so when it rains, just like Turkana County Referral Hospital, it was flooded, including the whole place, Madam Speaker. Yeah, do you mean Senate has reduced itself until we are discussing leaking roofs of County Referral Hospital? The governor, Abdul Samad, of Mombasa must be ashamed. This is shame. This is in our report. It's shame. It's shame, Madam Speaker. How can you explain to our children in future that Senate sat to discuss leaking roofs? Madam Speaker, this is embarrassing. Then I know there's something else in Taita Taveta, in the health workers professionals. This one was in Coast County Referral Hospital, Madam Speaker. The issue of Utange Field Hospital should be addressed, Madam Speaker. The issue of perimeter wall. You know, perimeter wall. Even when Nehemiah, Madam Speaker, in the Holy Book, do they need Nehemiah to go to Utange in Mombasa to assist in rebuilding the wall like they did to Jericho? Madam Speaker. And you know, there are so many Sanballats who will tell them, even if a dog stands on that wall, it will collapse. Madam Speaker, the governor of Mombasa must be ashamed of himself. And I think Boni Kalwale, since he's one of the practitioners of the medical world, he should be the one calling out such individuals. We cannot sit here to discuss perimeter walls. Madam Speaker, on this report that we have looked at, I think I want to agree on the issue of elder sector.
Senator, okay, just 30 seconds to finish your sentence. 30 seconds.
Okay. Madam Speaker, thank you for that indulgence. I know you will do that because you are my neighbor. Madam Speaker, emergency and ambulance services. In Nandi, for example, there is 1,000 shillings you pay for fuel. Can you believe, Madam Speaker? Can you believe? I come from Nandi, Madam Speaker, with those many remarks, and for convenience of the House, allow me to support this report and let us adopt it for the betterment of our health sector in our counties. I thank you.
Honorable Senators, I don't see any other requests, so I call upon the mover to reply.
Thank you, Madam Speaker, for giving me this opportunity. Madam Speaker, I stand to reply to the Senate reports of Standing Committee of Health on the oversight and network engagements to the Taita Taveta, Mombasa County, Kwale County, which has been laid in the Senate. Madam Speaker, I appreciate the contribution made by the Senator Cherargei'S. Madam Speaker, so far, as a committee, we have visited 18 counties, Madam Speaker. And Senator Cherargei'S, I accepted your request